Welcome to the Beverly Hills Plastic Surgery Podcast. I'm Dr. Millicent Rovelo, and I am here with one Mr. World Master Expert, Dr. J. Calvert. How are you?
Yes, that is me, the World Master Expert.
You are a World Master Expert ranked presenter rhinoplasty surgeon.
I was going to make a different joke, but I'll let that go. And it had to do with the master part, so I'll let it be.
I think I know where you're going with that. And we're going to try and keep this PG-13-ish rated, so.
Fine.
Master.
Yes. A global master, as a matter of fact.
Yes.
I came from the Berlin.
You did.
I was in the Berlin for the global masters, and it was very good.
Right. So tell us about that. What is this meeting that you were there? And then we're going to get into why you are so highly ranked.
Well, and I don't want to spend too much time on that part, but this meeting was the third, and it's is it biannual? Yeah, it's biannual, which means every other year, right? So every other year we meet. It's the two rhinoplasty societies. There's the Rhinoplasty Society
Of America.
which is from the U.S.
Yes.
And then there's
Of course, it's the Rhinoplasty Society.
I added that, actually. But they do call it TRS. So that's kind of the abbreviation. That's the acronym. But then the other one is the Rhinoplasty Society of Europe. Okay. And we meet, and it's run, so it goes back and forth. The first one was at Versailles. The second was in Miami. And then the third one is back in Europe in Berlin. And this was called the Global Masters of Rhinoplasty. It was very cool. Basically, faculty was about 50 people or so, and it included everything from keynote addresses to master classes to, general lectures. And it was a cornucopium of rhinoplasty. It was the Comic-Con of rhinoplasty. A super, super nose geek fest. And I thoroughly enjoyed it.
Were there outfits?
Well, some.
Costumes?
I think we'll get into that at some point.
Nothing?
No. But there were some outfits that I probably shouldn't talk about on there, but it just drove me crazy.
Oh, yes. I remember this conversation.
Yeah, so we'll get to it in a minute. I'll let it be. But the big thing was the amount of education was just tremendous. I mean, the players that were there, just the top ranked guys from around the world, guys and a lot of rhinoplasty women.
Which is great because historically there were not a lot of women in the field of rhinoplasty. So that's great. That's great to see. And I know I definitely have met some at some of these international meetings we go to. And I love it. They're coming from all parts of Europe and from America, and they're coming in. They're breaking in.
Not sure why that's been the case. I mean, there are plenty of, there's a lot of female plastic surgeons.
Yeah.
Just for our listeners, there's more and more. In fact, I think the next few classes of USC residents are all female. And it's just traditionally it's been like rhinoplasty has not been where female plastic surgeons gravitated towards.
Right.
I no idea why that is. I mean, it's any other plastic surgery operation. I mean, it makes sense that, you see more females doing mommy makeovers, breasts and body and those sort of things. And facelifts are really common also for female plastic surgeons. But nose has just traditionally been like a bunch of really geeked out dudes just measuring alar cartilages and tip projection and just dorking out over the biggest details. But the girls were geeking out also.
Well, that's
for
great.
Sure.
So what did you talk on? What were your presentations on?
I spoke about mobilization of the lateral crura, when you do it, how you do it, how you support the tip and the nostril when you do that. Just for the listeners, the lateral crura are the cartilages that you see on the side wall of your nose at the tip. It's like there's foot plates in the middle that make that piece of skin between your nostrils called the columella, or as one of my patients called it, the call your mother. And she was from the East Coast, as you might imagine. And then the lateral crura are on the sides of the nostril, and they're really responsible a lot for keeping the nostrils open so you can breathe, and also for the aesthetics of the nose. So when we mobilize those cartilages, it's a big deal. And how do you do that safely? And in fact, Roxana Cobo, speaking of amazing nasal surgeons who happen to be female, she's from Cali, Colombia. I was going to say, I I don't know why I was going to say Chile, but she's not, there's no Cali in Chile. But she's from Colombia. And she said, when you mobilize those lateral crura, it is a free-for-all. You have taken away the structure and integrity of the nasal tip, and you really need to know what you're doing. Like she was like, okay, it's easy for Jay Calvert, I get that. Like the rest of you need to, and she was like trying to like reel everybody in because it looks nice. When I do, it looks great.
Slow your roll. Don't go out there like cutting these things willy-nilly.
Exactly.
Like know what you're doing.
Yes. I mean, and so she was like, hey, like, hold on a second. Dude, this is like, you can't just like do that. You got to know how to do it. And that's why I give the lecture. And then the other one was on how to save a damaged nose. Like when something's so damaged, like how do you like, give the nose CPR, get it to the ICU and bring it back to life. And it was good. I mean, I showed like rotting implants, like these silicone implants coming through the skin and how you fix that. And, and speaking of which, that's right. Publication on Monday. Just as I'm flying back into town, our publication with you, me, Adira, and Pasha came out in aesthetic plastic surgery, and it's great. It's about how to save a nose with an infected dorsal implant. And this is very common in Asian rhinoplasty where people have silicone implants in the bridge or Gore-Tex or Medpor, and they become infected, and how do you save that? So that publication was out on July 3rd.
Yep, that's for sure. So that's awesome. So you gave your talks. What else? Was there any other topics that you talked about?
Well,
you
I
said
moderated.
those are your two. Those are the two you talked about.
Those are my two
moderated.
lectures, but then I was moderating, which is a lot more interesting to me.
Yes, because then you can pick on people and call them out.
That is so not true.
That's what I would do if I was moderating.
Well, I do have a lot of questions when I'm moderating, so yes, that's what I do.
No, that's not the point. We all want to be collegial and promote our fellow colleagues and get the best that we can out of them, because that's the whole point of these conferences, is to learn. And I guess that would be the next question then is, did you take anything home from this lecture? Maybe that you might want to try, or that you're considering, or not considering. So
we always come back to the preservation rhinoplasty discussion, which for our new listeners, anybody who's listening for a while, have heard me chit-chat about this a little bit. Dr. Rovelo and I kind of go back and forth. Maybe I go forth more than she goes back on this stuff. But the concept with preservation rhinoplasty, which I think is a total misnomer, it is way more destructive than structural rhinoplasty. But the concept is that you don't need to change anything with the bridge of the nose. You can leave the middle vault intact, which is the part of the nose from the hump, down to the tip. Because what you're going to do is you're going to cut the internal structures, the septum and the bones that hold the nose, out in space, and you're going to push it in towards the face or move it from side to side. And I really got that for a crooked nose that looks beautiful, but it's in the wrong place on the face, that this would be a good way to do it.
That'd be a great way to do it.
Yeah, you just kind of cut her all the way around the bones. You got to cut through the septum. You have to literally detach the structures of the nose that keep it attached to the face. And obviously the skin is still intact. This is all under the skin. But then you can move the pyramid. It'd be like taking one of the pyramids of Giza and just picking it up off the earth and moving it over 3 feet and putting it back down. It would still be the exact same pyramid, but you've just moved it to a new place. And I felt that was the first time I saw a problem solved for me because I've just done like 3 of these where the nose looked really good. It was like a great nose, but it was in the wrong part of the face, and it really needed to be moved a lot. And in order to do that with structural rhinoplasty, it's a lot of complicated cuts. And I do it. It looks great, but this seemed like really simple, like cut around the bones, take a strip out of the septum, move it over, and Bob's your uncle. You got a nose that's in the middle of the face, and it won't be going back. So I thought that was very helpful.
Well, that's great. So one take-home lesson that you can bring home with you. Anything else about this meeting, Dr. Calvert, you'd like to touch on?
Yes, there was a really key thing, too, with crooked noses that I'm going to implement immediately.
Ooh, what's that?
Which is that you should Botox the nasalis and the LSAN, the levator alkanesi muscles, right after or even in the OR when you're straightening a crooked nose so that they can't pull on the nose and pull it back.
You had me at Botox, but yeah. I mean, it makes sense. We do
Right.
that for our blepharoplasties. We Botox the orbicularis so that it doesn't pull on our incision lines. Makes perfect sense that you would Botox the nose. And people don't realize that there are actual muscles in the nose, like on the side wall of the nose under the skin. They're very thin, but they're what, they call them the bunny lines. When you wrinkle your nose like a bunny, those are the muscles that allow you to do it. So it makes sense that you can paralyze those and keep it from moving.
Yeah, and this is a lot of surgeons doing this, and they said it's very effective, and they think it's really helping in keeping the nose straight. So I am going to jump all over that, and I did a patient right before I left for the conference, and when I came back, I told her, and by the way, when I see you next Thursday, we'll be Botoxing your muscles because I want to keep your nose straight.
I'm sensing a lot of Botox in your future because then it's going to be like, well, while you're there and you have the Botox open.
Totally. Yeah, that's true. I mean, why not, right?
Get ready.
Yeah, so I thought that was very useful. I also learned that that I need to give a couple of lectures or presentations or articles. And, I talked to our scribe, Adira Croyardi, today and said, what we should do is we should do a paper about primary rhinoplasty and how you manage lateral support, like how I manage it, because everybody does it differently. I should really harp on that I have a way that I do it. It's, everybody's got a different idea, but I think the way that I've done it over the years, and I have over 5,000 rhinoplasties under my belt now. It's worked very well, and I think it's very reliable. And it seems to be when we train the fellows and the residents that they like it, and the patients love the look. They come to me to get this look of the tip of the nose.
Right.
It's very natural. It works. And there are some downsides, and there are complications with everything that are annoying. Like, the grafts can get a little thick. They can need to be trimmed or injected with steroids. Those things do come up. So nothing's perfect, but reliably, I get really nice looking results that last over time and people can breathe. So that's why I think that needs to be discussed because it's not well understood.
Well, that brings us to our next point of this podcast, which is that you were just very recently nationally ranked for what you do here with rhinoplasty. So if I may, introduce the number 3 rhinoplasty surgeon in America. Congratulations, doctor.
Thank you. I think, it was a big deal. I think there's a lot of validity to that study that Newsweek did, and this.
And I should say this is ranked by other plastic surgeons.
Yeah.
So this is not necessarily poll the audience. It is polling of our colleagues and our peers to submit who they think, is best in all of these categories. So this is as voted by people who actually really know the science of what we do and how we do it and are intimately involved in this topic. So I think that does carry a little more weight too.
Yeah, and they, Newsweek works with an organization called Statista, and their whole thing is about eliminating as much bias as possible in these studies. And I did the survey as a plastic surgeon. So what happens is they send out a survey by email, and it says, this is the Newsweek survey for the top plastic surgeons. You've been asked to complete the survey. You can vote for anybody who's board certified. You can't vote for non-board certified people. That's one thing that they said. And they can be, plastic surgery, facial plastic surgery, oculoplastics, whoever you think does these procedures best, but they have to be boarded in some
That
of their
specialty.
board.
Yeah.
And you cannot vote for your colleagues. So if you have any business relationship with the surgeon, like I can't vote for you or Dr.
versa,
Orden
yeah.
or Jabin Gabe or Ritu Chopra, any of our colleagues.
Which is difficult when you live in Beverly Hills because there's like 50 colleagues.
Yeah, it's
And
true.
they're all pretty
and we're
good.
connected.
And yeah.
Right. And you can't vote for people that you have any business affiliation with. So like the people that are in the fellowship, like I can't tell them that Justin Perez is amazing or that Luis Macias is amazing because they do the fellowship with us. And I can't tell them that Mark Urata is great for something. So those people are off the list for who I can vote for, and you cannot vote for yourself. And then they want 6 plastic surgeons in each category: facelift, rhinoplasty, breast augmentation, liposuction, and blepharoplasty, eyelid surgery. And so like when I was doing it, it was actually really hard. Like I really had to think through, if it's not the people that I know who are amazing, well, then who is it?
Right.
And then you have to really come down to like, well, who is it? Because it's like there are people that talk on the podium. There are people that do a lot of surgery. Who would you send your family members to? And that's how I did it that way.
Right.
And yeah, there's some obvious choices for me, people I know that are amazing and do great work, but 6 in each procedure?
Yeah, that you don't know personally, it's harder.
So I think the study has validity, but there's also a level of, familiarity and popularity contest in it too, because there are some people that are ranked very highly that don't do, some of these procedures that frequently, but they're just known names around the country
Right.
but as top plastic surgeons.
Yeah, that makes sense. When you're just trying to fill in numbers and spaces. Like,
Yeah.
who do I know of? Who do I see on the podium? Just filling it in. But that still being said, these are still people who are obviously, for some reason, ranked very highly amongst their peers.
Of course.
So it comes with a certain set of validity. But I think that's huge. That's very impressive. Number 3 is a very highly ranked number. Number 1 on the West Coast.
Yeah, that's
Number
true.
1 on the West Coast.
Yeah, I know. That's I'll take it. Being in the top 10 of anything of that level by your colleagues is
It's
a
huge.
compliment. It is, I'm very grateful that I'm recognized that way by my colleagues for what I do. I think that I do a ton of teaching. We run a top notch. Our fellows started their year yesterday, and it's just it made me happy that at least there's some recognition by the people that are, I'm trying to help. I'm trying to teach our colleagues. I'm trying to obviously take care of the patients, number one, but how you do that is like, I don't know if the public really knows this, but we're constantly evaluated by our peers.
Oh, yeah, big time.
Constantly.
Yeah. You can't pull one over. You might be able to pull one over on social media and on patients or potential patients, but amongst ourselves, like anything I post, anything I say, anything I put on my website, I'm always viewing it through the eyes of my colleagues. Like, what would my colleague say looking at this result or looking at this statement that I'm saying? Would they call BS on it? If
Absolutely.
so, then maybe I should rethink that.
Yeah, you don't want you have to do that, number one, because if we're getting privileges at a hospital, they're going to review our practices. That's part of the deal.
Yeah.
You don't just get privileges at Cedars-Sinai because, you're a nice guy and pay your dues, your staff dues. You get them because people say, yeah, we want this guy around. It's helpful. He's got skills. He's board certified. All the things they review, and they want to know that you're on the up and up, and that's how you get privileges at these places, and again constantly evaluated.
So I think all of these things just go back to show that we are constantly evaluating ourselves and our colleagues, and as demonstrated by your recent week and rankings, you are well revered and you are very highly regarded amongst your peers. So congratulations, doctor.
Thank you. I appreciate that. And as I always tell everybody, that's really nice, and you're only as good as your last case. So check your ego at the door and do a great
And
job.
get back to work.
That's it. I cannot stress that enough to anybody who thinks that all that, it's important, yes, but on the other level, like the next case has to be my best one ever. That's just the way it is.
I 1,000% agree.
I know. And that's what, you and I both agree with that. The day that you're walking into the operating room, whatever day that is, that should be the best operation you've ever done, because you have all your experience, you have everything that you've ever learned, that that you've done, the experience of all the previous cases, your planning, your setup. And so why isn't that day the best operation you've ever done? It ought to be.
And there you have it, guys. And this is the Beverly Hills Plastic Surgery Podcast, coming to you from the 90210.